Hello and welcome to your Harrisburg Area Community College Blended Learning EMR program. James Weber here, working on the chapter for emergency childbirth. Real quick, wanted to work through some of this content. Childbirth. Childbirth is a normal, natural part of life. We've been given birth in huts for a billion years, and I tell you something, it's kind of occurred without EMS existence, right? Childbirth is a thing that has happened well before we had healthcare to help the process along. Your part of the process isn't to do the skill. The skill gets done by the person delivering the baby. Your part of the process just involves helping the process along, guiding it, and supporting that newborn as they're born. After birth, you should ensure that newborn is breathing adequately and being kept warm. Two indicators of impending birth, of course, frequency of the contractions and crowning. Anatomy and function of the female reproductive system. The ovaries. The ovaries produce eggs. The egg travels through the fallopian tubes into the uterus. The uterus holds the fertilized eggs as it develops during pregnancy. The developing newborn fetus is encased in an amniotic sac for support and floats in that amniotic fluid. The external opening is called the birth canal, vagina, right? And here's why this makes a difference. It makes a difference from a perspective of the stages of labor, okay? The first stage of labor, where the pregnant woman's body begins to prepare for birth, characterized by a couple of different conditions. Initial contractions occur, the bag of water breaks, the bloody show occurs, the newborn head does not appear during contractions. Second stage of labor, of course, is the beginning of the birth of the newborn. You'll see a baby's head and begin to crown during these contractions. At this time, there's no opportunity for transport. The go, no-go decision that occurs during this period of time is there crowning? Because if there is crowning, you've got to stay and deliver that child before the child can be transported. Third stage of labor, delivery of the placenta. You are to assist in stabilization of the condition of the mother and the newborn and delivery of the placenta itself. Is there time to reach the hospital? This is really that go, no go, are we going to transport type dilemma that we get into in EMS, right? A couple of different key things that might be helpful. Is this the person's, patient's first pregnancy? Because if it is, I tell you something, these are pregnancies that take a while. These are not super fast deliveries when it's their first pregnancy. Women experiencing their first labor, of course, will have a little bit more time. Has the woman experienced a bloody show? If so, it's time to stay. Has the bag of water broken? Should the bag of water break? It's usually towards the end stage of the first stage of labor to give yourself a little bit of an idea as to how to gauge it. How frequent are the contractions? Contractions less than 2 minutes apart generally indicates that delivery will occur quickly. Does the patient actually feel an urge to move their bowels? When a newborn's head is at the birth canal, it presses against the rectum. It is not uncommon that parents or that the mother will have the desire to move their bowels because it pushes up against the backside of the rectum. Do not allow her to go to the toilet. Urge her to push and put her in a position where she's going to be comfortable for that delivery. Is the newborn's head crowning? Is transportation available? Is the ambulance responding? How far is it to the hospital? Will bad weather, a natural disaster, or traffic prevent prompt arrival of transportation? Time and contraction cycles. Time the contraction cycles from the beginning of one contraction to the beginning of the next. If the contractions are less than 3 minutes apart, of course, delivery is very close. Detecting crowning. Observe the vaginal opening during contraction. If you see the head crowning during contraction, prepare for delivery and don't risk transporting a woman to the hospital if you do see crowning. Preparing for delivery. As you prepare to assist the patient in delivery, keep a couple things in mind. Of course, calm them, right? Delivery is a natural process. We tend to get ourselves really worked up in EMS about delivering babies, right? But it's really a natural process that, again, has occurred for a long time before we got involved. So more often than not, we have to calm ourselves down just as much as we have to calm down the patient. You will not be able to maintain sterile conditions. There's this perception that it's a sterile procedure and we've got to stay clean as much as we can. Blah. Here's the thing: you're not going to be able to do it, right? Attempt to be as clean as possible. Wash your hands thoroughly and regularly if you're going to do that procedure. If you do not have a sterile delivery kit, use the gloves from your EMR or from your EMR jump bag, and have plenty of clean towels ready whenever that's possible. Place the patient on a firm surface that's padded with blankets, folded sheets, or towels. Elevate the woman's hip 2 to 4 inches with those pillows and blankets. Place the woman on her back with knees bent and feet flat on the surface beneath her. Standard precautions, of course, tends to be a big bloody event. Make sure you're putting yourself, wearing gloves, wearing face protection, wearing eye protection. Surgical gowns are a good idea as well. OB kit ideally is going to have all the key points that you're going to need, including everything from a bulb syringe to an actual surgical draping kit, and everything you're really going to need to cut the cord to take care of that child right from the point that they're born. OB typical contents, of course, placenta bags, sanitary bags, sheets, suction. These are just all things that you're going to need. If you don't have that on the EMS unit that you're riding on, try to get as much of this as possible because it's going to make a difference. Assisting with the delivery. There's 2 lives to be considered, mom and child. Do not neglect to perform a patient assessment on the patient, on the mother, right? We tend to get over aggressive in regards to dealing with patients, but it's probably pretty important that you make sure that mom's taken care of as well. Your primary purpose is to assist in the delivery of a newborn, right? Be as clean as possible during the delivery process. The newborn's head should emerge slowly to prevent undue stress on the newborn and tearing of vaginal tissues. As the head emerges, support the newborn's head and tell the woman to stop pushing. Do not attempt to pull on the newborn during delivery. Normal birth. The newborn will turn on its side by itself. As the head emerges, the rest of the bodies will be delivered spontaneously. Newborn will be wet and slippery. Keep the newborn's head at or about the level of the woman's vagina. These are just some pictures. You should be able to get this right out of the book, which gives you a little bit of a visual indication as to what this type of procedure is like. If the amniotic sac has not broken, tear it with your fingers and push it away from the newborn's head and mouth. If the umbilical cord's wrapped around the neck, try to get it out from around the patient's neck, right? If you can't disentangle it, the newborn, attempt to reduce pressure on the cord. Just don't pull on the cord itself. Caring for the newborn. Clear the newborn's mouth and nose. Use a bulb syringe if one's available. Suction the mouth first, and then suction the nose. If the bulb syringe is not available, wipe the mouth and nose with a gauze pad. That'll at least help. Place the newborn on the mother's abdomen. Keep the newborn warm, right? Because they're going to lose warmth pretty quickly, right? If the newborn is not breathing, suction the mouth and nose again. Use a towel to dry the newborn and wrap him up in a blanket to keep him warm, right? You want to do this relatively quickly once you've effectively evaluated the patient, as well as the newborn. Place the newborn on its side with the head slightly lower than the trunk. When the umbilical cord stops pulsating, clamp it and cut it. Note the time of delivery, right? There's multiple births. This is the point where you want to prepare for the second delivery. Placenta will deliver on its own, just kind of a natural process, normally within about 30 minutes or so of delivery. Never pull on the umbilical cord. Leave the umbilical cord uncut and attached to the placenta and the newborn until the EMS unit arrives. After the placenta is delivered, wrap it in a towel, put it in a plastic bag, keep it the same level as the newborn. It's pretty important. The hospital's going to want that for post-delivery, genetic testing and things like that. If the mother's bleeding usually stops after the placenta is delivered. If not, massage the uterus. Place one hand just above the mother's pubic bone. The other hand press down on the abdomen and using a circular motion, massage the uterus until it becomes firm. It should take about 3 to 5 minutes. It's called massaging the fundus. Continue to observe the mother and newborn and keep them both warm. About every 3 to 5 minutes, check the uterus for firmness, recheck the vagina for excessive bleeding, and in a normal delivery, they're going to lose about 300 to 500 milliliters of blood. Continue to massage the uterus if it is not firm or bleeding continues. Clean the mother with clean, moist towels. Give them a small amount of water to drink if they're thirsty. Resuscitating the newborn if they do not breathe on their own within the first few minutes of birth. A couple things we're going to have to do for those folks. Keep in mind we're going to work through a lot of those pediatric skills in your skills labs. Ectopic pregnancy and shock in pregnant women. An ectopic pregnancy occurs when a fertilized egg becomes implanted in the fallopian tube rather than the uterus, and as the embryo begins to grow and expands, it causes that fallopian tube to rupture. Rupture causes acute abdominal pain, internal bleeding, and shock. Treat the patient for shock and arrange for prompt transport. I've only seen this a couple of times, and I tell you something, these are patients that get very sick very, very quickly. This is absolutely life-threatening when we have an ectopic pregnancy. The big indication will always be in these cases that acute abdominal pain and indications of shock from a patient who was anticipated or thought to be pregnant, or at least of childbearing age. Miscarriage and vaginal bleeding. A miscarriage is the delivery of an incomplete or underdeveloped fetus. If a miscarriage occurs, save the fetus and all the tissues that pass from the vagina, control the bleeding, treat for shock, and arrange for prompt transport. Vaginal bleeding is often the first sign of that miscarriage. When a woman experiences vaginal bleeding, perform a patient assessment, get a good history, get a set of vital signs, arrange for prompt transport, and provide that emotional support. She's going to need it. Premature birth. Any newborn weighing less than 5 pounds or delivered before 36 weeks is considered to be premature. Premature newborns are smaller, thinner, and generally redder than full-term newborns. Keep premature newborns warm because they lose heat rapidly, and arrange for prompt transport. Unbroken water bag. Carefully break the bag and push it away from the nose and mouth so the newborn can breathe. Be careful not to injure the newborn in the process. Prolapse of the umbilical cord. The cord may be compressed between the newborn and the woman's pelvis during contractions. Place the pregnant patient in a position that raises her hips, right? Keep the cord covered and moist, and do not try to push it back into the vagina itself. Administer oxygen if it is available, and arrange for prompt transport. Some EMS systems recommend placing the woman in a kneeling position to take pressure off the cord, and that is generally recommended. Breech birth. The newborn buttocks comes down the birth canal first rather than the head. Arrange for prompt transport. Support the newborn's buttocks and legs as they're delivered, and the head will traditionally fall in on its own. If the head does not deliver within 3 minutes, arrange a prompt transport. In rare cases, the arm of the leg is the first part of the newborn to appear in the birth canal. Limb presentation cannot be handled in the field. Stillborn delivery, right? Sometimes a newborn dies in the uterus before labor. Fetus will generally have an unpleasant odor and not exhibit any signs of life. Carefully wrap the stillborn newborn in a blanket. Turn your attention to the mother and provide physical care and emotional support. Multiple births. It's going to be more labor contractions that will start shortly after the delivery of the first newborn. Get ready to repeat this procedure over and over and over again until you run out of babies. Excessive bleeding after delivery. Approximately 1 to 2 cups of blood is lost during a normal traditional childbirth. Do not anticipate shock-like symptoms in that circumstance. Women who are, just shy of birth will tend to generate that additional blood volume that's needed to be able to deliver those babies. Excessive bleeding after delivery. If they are bleeding severely, right, we want to get 1 or more clean sanitary pads at the opening of the vagina, elevate the legs and hips, treat for shock, and arrange that proper transport. Encourage the newborn to nurse at the mother's breast. You may actually see some semblance of reduction of bleeding. Massage the uterus with your hand, and if the area between the mother's vagina and anus is torn and bleeding, you would treat that as an open wound, right? Treat that no differently than an open wound. Vehicle collisions in pregnant women. The woman shouldn't be examined by a physician. The forces involved, and even a minor crash, may be great enough to injure the woman or the unborn child. Properly assess the patient and assess for transport. If the woman exhibits signs and symptoms of shock, monitor the airway, breathing, and circulation. Arrange for administration of high-flow oxygen. Have the woman lie on her left side rather than her back. And, look towards that proper, fast, rapid transport. In rare cases, a crash could be severe enough to kill the pregnant woman, but not the fetus. Provide CPR to the mother while transport occurred to the closest medical facility. A little bit of a summary. A couple of key indicators in estimating how soon a delivery will occur is crowning, right? And the time between contractions. Both of those pretty important to figuring out how long it's going to take for that child to be born. Stage 1 of labor characterized by those conditions, right? You start to see the preparation of the body for that delivery. Stage 2 of labor involves actual birth. Stage 3, of course, is delivery of the placenta. Exercise standard precautions during delivery. After delivery, keep in mind you have 2 patients, right? mother, and a newborn. If the newborn does not breathe on their own, proceeds with the steps to resuscitate. Although most pregnancies and birth are uneventful, you should be aware that complications exist, right? Ectopic pregnancies and shock, vaginal bleeding, miscarriage, premature births, unbroken water bag, all these things are things that can happen during birth, and we've got to have a good working idea as to what we're going to do should we come across these. We appreciate your time, your patience, your energy, and we look forward to hearing from you at our next discussion. Have a great day.